Sponsor, Bay Area plastic surgeon, Dr. Stanley Jacobs. Thank you for joining us today. And today we're going to talk about nose surgery, or I guess the technical term is rhinoplasty.
Right.
Okay. And so walk me through exactly what is rhinoplasty and why might somebody undergo this procedure?
Well, rhinoplasty is nose surgery, as you said, and it's a procedure that usually is for aesthetic reasons, meaning to make the nose look better.
Right.
Nose job is, it's called in colloquial terms. But it's a lot more than that, and that's what I want to get across today, that when people go to get their nose changed for the shape, that it has another function. You breathe through your nose.
Right.
It drains the sinuses, that kind of thing. It's exercise tolerance. So I brought up a few points that what patients could ask their doctors about what's going on, what to do. Here's what techniques are used. There's an open and closed technique where the incisions underneath under the tip of the nose, sometimes around the nostrils to narrow the base of the nose.
Oh, okay.
So there's different approaches, but usually all of them are inside the nose, inside the nostril itself, so you actually don't see anything.
Oh, see, that's why you don't see any scarring then when people say they've had a nose surgery.
Do I have a cut up here? No, there's nothing up there.
Oh.
It's all inside the nostrils, and then you go inside and make a tunnel with instruments and lift up with instruments to get inside to see the cartilage and the top and the sides.
So you actually reconstruct from the inside out then?
Yes, but sometimes you have to make work on the nostrils, or if it's a complicated case like a secondary, we call it procedure, then we have to do a little incision under here, lift the skin of the nose up, not to gross you out or anything.
No, but right.
And then that sort of allows you to look at the cartilage itself.
Right.
And then you can be more precise. I generally use those for patients who've had surgery before and they're a little more complicated. Say I have to do a cartilage graft from the ear to the nose, something happens, so it didn't work out with some other procedure. And I'm going to talk about that another time, more complicated kind of cases.
Yeah.
These cases are that we're going to show before and after pictures. In fact, if we could show maybe the first.
Yeah, we've got one here of.
Yeah, here it is.
Yeah, there it is. That's a phenomenal before and after, actually. So she came in. She wanted her nose reconstructed.
Right. And actually, I did also her sister, too.
Oh, did you?
So she knew that, my work, and her sister was happy, and so she came in and said, her front view was pretty good, and that's why we didn't show it.
Right.
But the profile really was what bothered her. This is a second case. We can just go back for a minute.
Now, is this one of those instances where you said you worked from the inside out, you actually went in and reconstructed the cartilage?
This gal actually, both of these I made a little incision underneath here, and it's difficult to see even on this fairly close-up picture that incision or scar. It's very difficult to see. But again, it's about proportion, making the top of the nose smoother, bringing the bottom up, but yet if you looked at the picture on the right, didn't know the picture on the left.
Right.
I don't think anybody would say she had a nose job.
No.
That's what we want.
And then we have one last one for you. Actually, that's a frontal shot.
And then here's the other but before that, here's the other profiles. We lifted the tip up.
Right.
And made the top a little bit smoother. Again, you don't have to make necessarily scooped or kind of cutesy, kind of too cutesy look. You could just make it bounce to her face, and I think, again, nobody really knows that she had nose surgery.
Right, no,
that's the idea.
And then here's the last shot there, the frontal view.
Yeah, the frontal view, this one, of course, is most obvious in the front, and that's why she came in to see me, because her nose was wider and she wanted it narrower. The profile wasn't that different. And she was one that we were talking earlier that came to me when she was 15 years old with her mom, and I said, you can't, your face is changing.
Right.
You have to wait till you're 17. And so to the day, I looked on the chart, she showed up. I'm like, whoa, you people taking this seriously.
Yeah.
So that was good, that she waited till the appropriate time.
And about 17 or 18 is about when the face has stopped forming. Right. That is your adult face from that point on. So it's
pretty well.
Okay.
Yeah.
And let's go on to the next question there. Who are rhinoplasty surgeons?
Right. There's a subgroup of people who do a lot of noses. Yeah. And I think that patients should ask approximately how many noses do you do a year, or how many have you done, or what's your expertise? And you shouldn't do one nose a month or one every 2 months. It's important to do a few a week, and 50 to 100 a year kind of thing. So that's important.
And let's see, we're just about out of time. What are the risks? That's a big one. We'll touch on that before we tell folks about the lecture. Yeah, we're bringing that up right now. But real quickly, the risks?
Well, the main risk is that you want to still breathe through your nose. You want to have good breathing afterwards. So think about the nose not just aesthetically beautiful, but also structure. Okay.
So if you would like to learn more about this, Dr. Stanley Jacobs is actually offering a lecture here in Healdsburg. That's the location of your second office.
Right.
And February 21st, 6 to 8 p.m. There's a number there on your screen to call for more information, 707-473-0220. And then obviously you can always go to Dr. Jacobs' his website, drstanleyjacobs.com. And if you can't make this, he's actually going to be putting together a DVD of that lecture so that you can view it later.
Right.
All right. Good service. Thank you so much, Doctor, for joining us this morning. And we will be right back.